An important discovery at the University of Canterbury could help addiction sufferers worldwide.
A researcher at the University of Canterbury has discovered a way to eliminate cravings for cocaine.
Cocaine and methamphetamine are two highly addictive substances. They increase dopamine in the brain, and this is what causes them to be so addictive.
The finding has been published in a leading American psychiatry publication. Cocaine addiction is at epidemic levels in the United States and some European countries, but treatments remain ineffective. Dr. Canales has found activating a receptor in the brain with chemical compounds will stop the cocaine from releasing dopamine. This reduces relapse, so would help addicts to withdraw from the drug permanently.
Relapse is the most important aspect to treating addiction. It's a very insidious and very difficult symptom to treat, and therefore any treatments that may mitigate this problem are important for us.
The results of the experiments indicate that the compounds work on methamphetamine in the same way. And New Zealand has one of the highest rates of methamphetamine use in the world. According to a 2010 Cabinet report, in 2009 the figure was 2% of the population. Another report found more than 10% of people arrested by police tested positive for methamphetamine. The encouraging results come from experiments on rats.
There is almost every chance that these compounds will work also in humans. We do express the same type of receptors in our brain. They are located in the same place. We have very similar biological systems, and we respond to the same stimuli, including drugs of abuse, in very similar ways.
At the moment, Dr. Canales and his partners are testing the safety and toxicology of the compounds. He says clinical trials on humans will run in Switzerland within the near future.
Obviously, in humans in the future, if these compounds go forward as potential medications, they will be administered orally like a tablet or something like that.
Because the release of dopamine is common to all addictions, Dr. Canales hopes the treatment could also apply to nicotine, alcohol and other types of addiction.
There is almost every possibility that we can treat other forms of addiction through activation of this receptor, and we're even hopeful that this may be even applied for food addiction.
It has the potential to help millions of people suffering from addictions and save millions of dollars in healthcare costs.